It is our privilege to welcome everyone here this evening to participate in our third reopening public forum for our parents and guardians, students, staff, and community members of both our CV Tech division and our special education division, as well as the rest of our divisions for CVES BOCES. I'd like to start off with an introduction of CVS's administrators and staff who are going to be helping lead this evening's presentation. First, we have Ms. Terry Calabrese Gray, our Assistant Superintendent for Instruction in 21st Century Learning. Next, Mr. Eric Bell, our Assistant Superintendent of Management Services. Third, Mrs. Michelle Friedman, our Director of CV Tech, which is Career and Technical Education for CVS BOCES. And next, Mr. Matthew Slattery, our Director of Special Education for CVES. We also have joining us this evening Mr. Jeffrey Sisson, our CVES Health and Safety Risk Specialist, who coordinates our programs and health and safety across our BOCES, but also works and leads our component districts across our entire region. And behind the scenes, we want to acknowledge Mr. Alex St. Pierre, our Network and Systems Coordinator. Thank you, everyone. And we're glad that you've met our team. And the purpose of this evening's presentation is to provide information about the reopening of CVES BOCES, which includes, as I mentioned, both CV Tech and our special education programs. CVS is very pleased that Governor Cuomo has indicated the schools in New York State may reopen. We do understand that the first priority of reopening schools for all of our students, the parents, families, and staff, as well as our communities, is to put health and safety of our students and staff as the first and primary objective. We also understand that these have been trying times for our entire school community, our state, our nation, and in fact, the whole world, as we've all been working diligently in response to this worldwide pandemic. We are very fortunate, as everyone is aware, to live in the beautiful North Country, where our upstate regional data indicates very favorably that our infection rate and spread has remained low. We acknowledge the governor's indicators are driven by data that will require close monitoring of our data and the infection rate, which will have a significant impact on whether or not our schools remain open. We want to thank our CVES team members for all of the work which has gone into the development of our reopening plan. These members include CVS staff that were on planning committees made up of stakeholders, teachers, nurses, administrators, aides, O&M staff members, our communication team members, and a board member. Across CVES, the leadership and work of our entire administrative team and supervisors and our dedicated staff have helped make this evening's presentation possible. It has allowed us to submit our plan to the New York State Education Department and the New York State Department of Health. That was done on July 31st, 2020, and has since been found on our district website. We want to further acknowledge that our component school districts, and there are 16 within our CVES BOCES, have worked closely in collaboration with CVES for many months to ensure the safety of our students and staff throughout all of our school communities at the highest level. We would also like to acknowledge the work and support of our health departments and their staff from Clinton and Essex County. The health directors from the Clinton County Public Health Department, Mr. John Canoza, as well as Ms. Linda Beers, the Director of Public Health for Essex County, have been outstanding with the support of their staff of our schools. Next, we would like to acknowledge that CVS's reopening plan has been based on state guidance from the New York State Education Department, the New York State Department of Health. We have used extensive resources from the CDC, as well as various other health organizations and best practices and research from across the entire state and the nation to support our reopening plans, our efforts, and guide our decisions to ensure the safest learning environment for all staff and students. I would also like to acknowledge that this is the third of our 3 public presentations to support CVS's reopening of our campuses. We want to note the importance and the value that the support of our parents and guardians and staff provides to our reopening plans. It's vital and essential. Please remember that we place your child's safety, our students, and our staff's safety as the utmost priority to guide all of our decisions. We look forward to your continued partnership and our work together as we move forward to share this information and answer questions you may have. Thank you. And as a final reminder, I'd like to acknowledge that the videos for these presentations will be found on our website. And I'd like to turn it over now to our Assistant Superintendent for 21st Century Learning, Ms. Terry Calabrese-Gray. Thank you, Terry.
Good evening. I just want to share that our plan is posted on our website. So if you go to cves.org, you can find it. It's in our updated stories running on our main page. And then we have several links off from there. So welcome for coming tonight and attending the session. I just want to say that we are utilizing WebEx. So we would ask that you communicate in the WebEx through, there's 2 features. There's a chat feature, which allows you to pose a question to us as panelists. However, other people on the public end cannot see that question. So if you have a particular question that might be more confidential or something you don't want to ask out loud to the whole group, you can do it in the chat. However, we would love to have people put it in the Q&A, because if you put it in the question and answer feature, then everyone who will see a response to that question. So you and the rest of the public would see that. So we encourage you to use both of those features that are in WebEx, but we would highly recommend the Q&A, and we will address those questions as we move along through the various sections of our plan. Just to remind everyone, our modes of communication, of course, our biggest ones are the web page that we have. Also, we have social media sites, mainly Facebook. We have a district Facebook page, we have a special education Facebook page, and a CV Tech Facebook page. We post timely information there to get out to the public and share with both parents, students, and our community. Again, we use email for our staff. That is like our primary mode of communication with staff and our organization, but also feel free to email any of us if you have further questions. And of course, you do get robocalls if you're an employee or a parent who has a student in our district. You definitely get the robocalls, especially for our snow days. And also, we do have phone and email, the good old-fashioned ways, which we do communicate much through those means as well. So we just encourage you as much as possible to utilize the various modes and stay up to date on things that are happening at CVES. One thing we do remind people too, if you're an employee or if you are a parent or student information, we just highly encourage you at all times to keep that updated, because we pull everything through our system from other systems. So if the information is not up to date, you will not be getting that information, and we want to make sure that you get it in a manner that is very timely. Something to note too, for communication purposes, we are required as an organization in schools to train people coming back to work and back to school. So we already have started with our 12-month staff. We provided training to them to come back on site and be on campus. And then also we will be providing that to our 10-month employees on day 1. And also we will be providing, not us ourselves, but our staff, teachers mainly, will be providing lessons for students to talk about all the necessary COVID-19 protocols in order to be safe at school and make sure we're doing everything we can to minimize the spread, and hopefully we will have no spread. So that is our goal, and the people after me are going to start outlining what that's going to look like for various divisions and also various sections of our plan or portions of our plan that we will go into further depth. And just really, we highly encourage you to ask questions. We do have questions that have already been submitted, so we will answer those within the parts of our presentation. But again, we encourage you to use that Q&A feature. So I am going to turn it over to Mrs. Friedman for a review.
Thank you. Good evening, everyone. I am very pleased to have the opportunity to share with you our reopening plans for the CV Tech division of Champlain Valley Educational Services. In our reopening plan for the district, the components of each of our levels are outlined in our continuity of learning plan. And last Thursday, we had the opportunity to spend the hour specifically talking about the intricate details of how we plan today to reopen the CV Tech division. And so I encourage you, if you have specific questions, to either put them in the Q&A, reach out to us. We see these 3 evenings as the beginning of the conversation. Many of you have been involved with us in our planning and our construction of the framework. But as each day passes and as the data is updated, so must our plans. So for the purposes of this presentation tonight, I'm going to share with you the highlights of the reopening plan for the CV Tech division, but I encourage you to reach out with specific questions to the point of even giving us a call, and we can arrange a face-to-face or virtual face-to-face meeting just like that, just like this, to walk you through all of that. Before I do talk about the level 3 hybrid model, I do want to assure our parents and family members and even students who may be on the call that all of this information that's being outlined tonight has been compiled into a student welcome packet, which was mailed to each of our enrolled CV Tech students, and that went out in the mail on Monday. So you might have already gotten it already, but if you should be receiving that by the end of the week, which will have the hard copies of the information that we're sharing, along with all of the other information that you have to fill out as parents to begin the school year. What you also have in there is a directory of all of our offices, pictures of our faces, and how to contact us so that we can walk you through any of these questions that you may have after hearing this framework tonight. So for those of you who are familiar with the CV Tech model, when we're not in a pandemic situation, we typically have a shared school day with our 16 component districts. So students who have CV Tech on their schedule, they either begin their day at homeroom at their home school, and then they get on the transportation provided by their district, and they come to CV Tech for the morning. They return for their afternoon classes at home school. Or they start off their day at home school, they complete morning classes there, and then they travel to CV Tech for the afternoon session. So with the situation that we're in right now and the levels of continuum that you see on the screen, level 1 would be that model that I just described. And level 5 being what we had to resort to in March of last year when our schools were closed. So we went from a level 1 green to a level 5, everyone learning from remote. With the governor's decision to allow schools to reopen, we decided that the best model to serve our school districts, to serve all of the recommendations and guidance for health and safety, to begin the year at CV Tech in a level 3 hybrid blended model. So what this will entail is that our students will still attend a shared schedule between CV Tech and their home district, but it will look different than what they've experienced in the past or what you expected if you are new to CV Tech this year. So the next slide indicates what the breakdown of a level 3 model would look like. So in conjunction with extensive conversations with our 16 districts and the diversity between the size of our districts, the locations being spread out from the top of Clinton County all the way down into Essex County, we needed to prepare a model that would serve best for our districts so that our students can have ACTE experience. That conversation resulted in the construction of this model wherein our first year students or students who are new to CTE would be grouped in a cohort A. And then students who are returning to CV Tech for their second year or have been with us before would be grouped in cohort B. The cohort A students would attend CV Tech all day on Mondays and Tuesdays, and then have their homeschool classes scheduled on Wednesday, Thursday, and Friday. In the same respect, the cohort B students would have their homeschool classes scheduled on Monday, Tuesday, and Wednesday, and attend CV Tech full day on Thursday and Friday. Now, due to the diversity of our different districts and the nature in which they are constructing their reopening plans, some school districts will have live on-site classes for their students when they're at the homeschool. Some will have remote classes. Some will have a little bit of both. So depending on what home district you reside in, that will dictate how your 3 days when you're not at CV Tech will work to receive the classes that you need to fulfill your graduation requirements. So one of the largest shifts, besides coming all day, is the fact that students will be arriving at CV Tech at 9 in the morning and will stay until 2:30 on the day that their cohort is scheduled. So that poses a lot of different nuances that we've not had to experience before. One being lunchtime, which is important to every single high school student. We know that. So what I am very pleased and proud to tell you with the work of our Assistant Superintendent Management Services and our food service manager, we have obtained a grant, a community action grant. I hope I did not misrepresent the name of that grant, in which all of our CV Tech students, when they are with us on campus, will have access to, at no charge, both breakfast and lunch. And they will have a scheduled lunch period, and we will work through the details about making sure that their nutritional needs are met while they're with us at the CV Tech campuses. Also, what is important about the shift in schedule is the district transportation. There were questions about how does my student get to CV Tech. The rules still apply, whether we were in a green level 1 or a yellow level 3. The district in which you reside will still be responsible for providing that transportation. So again, you'll have to reach out to your home district to determine whether or not it's an actual home pickup from your home directly to CV Tech, or whether it's a home pickup and then brought to your home district and then on a separate transportation to CV Tech, or whether or not it is something of that, something blended in that. But your district is responsible for providing transportation. We are expanding our driver policy, in which we do allow drivers to come to CV Tech and drive themselves. However, that is a process. It's an application process. In the past, it was only for conflicting schedules, whether they were work schedules or whatnot. But we will expand the opportunity for driving to be done by individual students. But we must need that paperwork filled out in advance and approved by the home district prior to any student driving themselves. So I don't know if we have any questions yet in the chat at all. Anything? No? Okay. And so thank you. As I mentioned before, your student welcome packets for all the students that have been enrolled. And just so you know, our enrollment process begins in May of the previous year. So all of the enrollment of students who worked with their guidance offices and articulated the desire to participate in our CTE programming have been enrolled by their home district by the close of last school year. So by June of 2020, all of those students have already been enrolled. So those students will be the ones who were slated to receive those packets. If you didn't get one, or you do get one and you're not clear on the information that's included, please reach out, give us a call. We can connect you with the building principals with our guidance offices, and me even. If you want to talk to me, I'd be more than happy to do that. We are so excited. We are so excited to have our CV Tech students and teaching faculty and staff back on our campuses, accessing our extensive equipment and leaning into the expertise of our business and industry experts, and we just couldn't be more thrilled. But we understand that parents and families have questions and concerns as navigating this new normal, and we want to be available and accessible to you to make sure that you feel absolutely comfortable on that first day of school when your students arrive on a CV Tech campus. So thank you very much for this opportunity to share, and I'd like to turn it over to my colleague, Director Slattery, for the Special Education Division.
Thank you, Director Friedman, and good evening, everyone. My name is Matt Slattery. I'm the proud director of the Special Education Division at Champlain Valley Educational Services. I hope this forum finds you and your family doing well during these challenging times. A lot of time and care has been dedicated to the development of our reopening plans. I think it's important to know that the health and safety of our students, employees, families, and communities were and continue to be at the forefront of each decision made. Our plan is intended to communicate the adaptive design of our learning model and to accommodate changing conditions and evolving guidance from state and health officials. Tonight, we will outline an abbreviated version of our Special Education Division's reopening plan for families. This 8-page document is intended to be a parent-friendly plan that provides details of our day-to-day operations. Yesterday, we were able to review this document in full. Please know that it is now available on our website, and it will also go out in the mail and our welcome packet to families tomorrow. As you can see from this slide, we have created an opening schedule that features a staggered start for in-person instruction. Students will begin instruction on September 8th, either in person or via remote learning. Please note this is a program and building specific, as outlined in this chart. On September 14th, all of our students will be in our buildings for in-person instruction. Opening school in this manner is important. It allows each building to be better prepared for the significant shift in routine that is required for in-person instruction to keep our students and staff members as safe as possible. Now for our models of school continuum, this is the same as Director Friedman just outlined, so you can tell that we created an organization-wide approach with our 5-level system to outline, our learning model for this school year. For tonight, I'll focus on giving an overview of in-person instruction with mitigation in place, level 2, and that is how we are starting our school year, as well as remote learning expectations, which spans across levels 3 and 5. So this is inclusive of our hybrid and remote learning models. As a reminder, please know that our comprehensive reopening plan for families is available on our school website. Our in-person instruction model is built around single classroom pods. The reason for this is to limit exposure to others. This concept is applied across our entire school day, whether students are in special area classes like physical education or art, or eating lunch, or on the playground. We have created multiple safeguards to ensure that students stay with their classroom set of peers. This system can be changed to meet the needs of our students as this public health crisis continues to evolve. When it comes to masks, all students and staff are required to wear masks while in school. In instances where a child is unable to wear a mask due to a medical reason, receipt of appropriate medical documentation is needed for us to make a request for a change in condition if the student has an IEP or 504 plan. We are approaching this new school year with proactive strategies in place for a successful return to in-person instruction. This includes prioritizing the social and emotional well-being of our students, enhancing our PBIS model, giving direct instruction to students on all of our new protocols and safety procedures, and creating a consistent set of procedures for our indoor and outdoor spaces. Microsoft Teams will continue to be our unifying learning platform for all classrooms. This instructional tool will go into effect at the start of the school year to build student confidence in its use. Our hybrid model has been developed to capture the best of in-person and remote learning while reducing our student population in the building by 50%. You can see the schedule with identified groups of students receiving in-person or remote instruction. Wednesday is all remote, and this will allow for us to do a deep clean between the two different groups of students attending in-class instruction. When it comes to remote learning, we have made great progress. First, closing out the 2019-20 school year, then with our remote learning experience this summer in our ESY programming. And if we transition to remote instruction this year, we are prepared to provide an even better experience with what we have learned over the past 6 months. Our new remote learning model features increased expectations for teaching and learning. It will utilize a blend of live instruction and teacher-designed learning activities, and it will feature a weekly schedule created for each student to organize and clearly communicate expected learning opportunities. And you can see an example of one right here on our screen. Please know that this is specific to each classroom and program that our students attend. Equity and access is very, very important to our student success. Students without access to technology or internet will be referred immediately to our building principals for support. Our principals will use all the resources available to them to appropriately support each family. Many thanks to the United Way for their support of our organization and communities. Due to their partnership, we will have dedicated devices allocated for student use in the remote setting this school year. And finally, we have a completely virtual learning option for our families. Families who have concerns about their child's health or well-being or impact on a family member may choose to have their child engage in a completely remote learning option from home. Families interested in this option are asked to reach out to their child's principal at their attending campus for more information. And finally, I'd like to thank everyone for being here tonight. Our school community continues to remain strong and work together. I understand that we are all experiencing different challenges, and please know that our faculty, staff, administration, everyone at CVES is always here to help support your child. Please continue to visit our school website for the most up-to-date information. And finally, should you have any questions, please reach out to our excellent school team. We have principals on both campus. You can reach out to me. We'd be happy to have those conversations with you because we know how important it is that you have the information that you need to make these important decisions moving forward. Thank you.
Thank you both.
Yeah, go ahead.
Thank you to both Matt and Michelle. Excellent job on CV Tech and Special Ed. And I was sort of blind because we were doing our presentation, so I don't see any questions yet. So you guys must be doing an awesome job. So we are ready to move on to health and safety. And so Jeff, I believe you were going to jump in, and that's your bailiwick. So take it out.
All right, thank you. And you two are tough acts to follow. You did a great job. So I'm going to try to do as well as the two of you did. So here we go. First, I want to start off by saying that as Ms. Calabrese-Grace had stated earlier, we have been back in our buildings now since, some of us anyway, since July 20th. We created safety plan in order to do that, along with New York State guidelines. We created training materials for our staff. We trained our staff. We prepared our buildings ahead of time with socially distanced markings on the floors, with signage around to remind people the behaviors in which we need to exhibit and work within our confines of our buildings. We've developed different policies as a result of that. And honestly, there was some trepidation before we started for some people. I mean, there's a what's it called, Terry? There's a scale. What am I thinking about?
Continuum?
Thank you. There's a continuum, right? And people fall on different places in that continuum, whether we're talking about how hungry you are, how well you slept at night, right? But also how nervous you are about coming back to work. And I'm sure it's the same thing with people thinking about coming back to school. And we had people on different, complete opposite sides of that continuum. Some people thought, hey, it's no big deal. I'll be back, no problem. And other people that were truly concerned and worried. And after going through the process, going through the trainings, you know, spending time with people, listening to people, developing our program and our safety plans, we started. Everybody's back now. We've all been back since August 3rd, and honestly, it's much easier than we thought. And I hope we find that same thing is true in the fall when we bring back our students. But even the people who had a lot of trepidation about coming back and were very uneasy about it, it just, believe it or not, it seems as if it's just kind of, and again, I hate to use the new normal, but it just seems normal. I mean, a lot of the things we're talking about doing, like wearing masks or staying physically distant from other people, are so ingrained in us at this point, it just seems like second nature. So a lot of the things we're asking our staff to do, a lot of the things we're asking our students to do are just going to feel like, oh yeah, that's just how we do things. And it just feels, in fact, it feels unnatural to not do those things at this point. So I think my own feeling on this is that it's not going to be getting back and getting into the classrooms with the desks spaced out, with lines on the floor, staying distant to other people when you converse. It's probably not going to feel as alien as it would have thought 4 months ago, because we're all pretty conditioned to this at this point. So that is my hope, that it's as easy as I hope it is, within reason. And again, you know, the things that I'm going to talk about, I just want to point out there are going to be training opportunities for parents. We're going to have training opportunities for students to go over all the things I'm mentioning. And of course, I think Terry mentioned the staff as well on opening day. They're going to get a lot of information as well and training. So I'm going to go over some of the things for health and safety. These are all requirements from the Department of Health and the State Education Department. One of the things we're doing is a daily screening, daily health screening for all staff. And we've been doing this since we came back in the building on July 20th. And it is the same 4 questions that I'm sure that you're all very aware of at this point. Loosely, they are, do you feel well today? So in other words, you don't have a fever, you don't have a cough, those types of things. The next one would be, have you been diagnosed with COVID-19? The next one might be, have you had contact with somebody who was diagnosed with COVID-19? And then the fourth one is, you know, have you traveled internationally or to a state with a high incidence of community spread? And you can find that information on the New York State website. If you search New York State travel restrictions, COVID, I think it pops up. And you can see a list of those. So those are the daily questions that we are currently asking our staff to answer before they come into our buildings. We're going to be asking you as parents and students to do the very same when you enter our buildings come September. So we are asking parents to ask their students how they feel that day before coming. We ask that they take a temperature, either with an old-fashioned thermometer or one of the digital ones or infrared ones. We are asking you to do that. And if you have any questions, again, there will be a packet that goes out. There'll be online videos for you to watch to help you go over that prior to the beginning of school. So if you have any questions, reach out to either myself or one of the directors or principals, and we can help you through that. More to come, though, more to come. So masks and face coverings, by law, we're required to provide those to our students and staff if they need one. We do have them in stock. And it's okay. I know some students may want to wear the ones that they have at home, the one that they're comfortable with, the one that they found that fits well and fits comfortably. That's all good. That's great. They can wear their own as long as it's in good working order. It's made well, right? It's clean, and it's appropriate. So as long as it has all those things, so it doesn't have like a bad word on it or something like that. So as long as it meets those requirements, they can wear their own. If they need one, we have them here. So that's good. And we are, like I think you heard throughout the presentation earlier, masks will be worn at all times except during meal times. And we realize it's hard to wear a mask all day. So there will be scheduled mask breaks for students and staff have times to be able to take that off throughout the day. And that's probably something that we have to kind of build into the curriculum just to kind of see how long we can go before scheduling those things, just because it'll be different for different people. But we are working on that, and that'll be something that evolves. Social physical distancing, we already talked about it, it's paramount. And I mean, it's something that's so very important. So people will be 6 feet away at all times, unless for whatever reason it can't be, like maybe they have to go up and talk to a teacher about a question or a problem. In those cases, it might be within the 6 feet, but it'll be brief. And both people will be wearing masks, obviously. But the rule of thumb is 6 feet of all times, unless for some whatever reason it has to be a short thing that is not. And again, how do we do that? Spacing of desks, how do we do that? Markings on floors, they're right here by my desk. So a lot of things like that. And then reminding people that when they walk down the hallway, they need to walk with their right shoulder against or near the wall. So that way, our walls are like 8 to 10 feet wide. So if each person walks close to the wall, you're going to have that 6 foot space between you. So it's things like that. And again, it sounds like, oh, that sounds like hard, a lot to remember, but I think it'll become easier as we get going. So healthy hygiene practices. So lots of hand hygiene is going to be a big part of the safety plan. So washing your hands, obviously, after you use the restroom, washing your hands before you eat, after you blow your nose. So a lot of those healthy behaviors and hygiene practices will be reviewed with students and staff. We will have plenty of soap and water. We're going to have plenty of paper towels for drying hands. We have locations where, and I think every classroom is going to have hand sanitizer available. It's scattered around in places where we don't have sinks available as well, especially in places where we might have shared equipment where different people have to use it. There is hand sanitizer in those locations, to be sure. Lots of signage to remind people to do these things. And I know Ms. Calabrese-Gray mentioned the communication part of that, and signage is a big part of how we're going to communicate and remind people of the behaviors that we all have to partake in, and hand washing and remembering to do that at certain times is what signs are going to be a big part of that education. So part of the training is going to be reminding people to look for signs to help remind them of the things and clues to things that they need to do. Besides hand hygiene, we have respiratory hygiene. So reinforcing those behaviors we've been talking about for years about sneezing or coughing into your elbow or your shoulder. If you do sneeze into a tissue, obviously you throw the tissue away and you clean your hands or disinfect your hands with the hand sanitizer as soon as possible. Trying to think what else we have. We are working closely, and I know that Dr. Davey mentioned this at the opening, with both health departments, so the Clinton County Health Department and the Essex County Department of Health. We're working closely with them. We're following the CDC and New York State Department of Health guidelines in terms of returning to school and helping with contact tracing if there is a positive case. And we have 2 people, Mr. Eric Bell and Terry Calabrese-Gray, have been identified as the people that will help the health departments in doing that tracing if they need our assistance. And one thing that I do want to mention to parents, I think, first of all, make sure you update your emergency contacts before the end of the year. But really, most importantly, especially for people that might have difficulty with transportation, try to find people, identify people within your family who may be able to come and pick up your child or your student if they're not feeling well. Because we'll be keeping them here, but because of guidelines, it's going to be very tricky to keep kids separated during those, or keep them isolated during those situations. So if you can think about who might be able to come and help us in those situations to pick that child up as soon as possible, that would be greatly appreciated. We do have emergency response protocols. We still have fire drills that we have to do. We still have lockdown drills we have to do, lockout drills. So all the safety requirements are still in place. We just have to figure out ways to do them where we're still managing to socially distance people, or physically distance people, excuse me, and also continue to wear our masks. So if you imagine a fire drill, what that used to look like was pandemonium going, well, not really, but a lot of kids all in the hallway at the same time. We'll probably do really pretty much what I was mentioning earlier. Kids exit the room, stay right to the wall with their right shoulder, and they do that on both sides. I guess it would be the left shoulder for the kids on the other side, but 2 separate files on either side of the hallway going out. They might get closer than 6 feet as they go through the double doors, but that would be it, and it's such a brief thing that's not even considered a close contact. So we just have to figure out ways to do that and help the students know what our expectations are. Any questions have popped up out there in chat land at all?
I don't
No?
see any.
Okay. So some of the questions that I have from earlier was, are all staff required to wear a face shield or mask? We covered that. That's mask, yes. We're not really mask, but a face covering. Can students wear plastic face shields instead of a mask? The answer is no, but yes. So as a rule, no, you cannot wear a face shield instead or in lieu of a mask, because the mask does a really good job of protecting other people from whatever illness you might have, because it captures the respiratory droplets as they leave your mouth. Now, a face shield is out here, right? It might stop the respiratory droplets when you cough or sneeze, and it shoots up against the plastic, but your regular breathing, that's just going to escape underneath or around behind the mask and go to people. So that's why we really want to make sure that we have a mask at all times, or we are really socially distanced. So if students cannot wear a mask, they can't tolerate the mask, I think the shield is a great second choice. It's the next best thing. So we will try to implement that and see if maybe students can tolerate that. So no, but yes. Okay, so if my child is sick and do they need to get a COVID test to return to school? That question is a great question. I'm sure a lot of people are asking that question, or at least thinking about it. And the answer is, right now, we're not sure. It sounds, after talking to the health departments today, that all that guidance is going to change. Currently, we're thinking what it's going to look like is if you're sent home with symptoms of COVID-19, and you go to your physician and you get a test and it's negative, you can return after 3 days without symptoms, whatever those symptoms were, or 3 days without a fever, and then you could come back. Or you could go to your physician and they could say, those symptoms have nothing to do with COVID, it's part of a pre-existing condition, or it's part of a pre-existing illness you have, or something like that, and then you can return to school. If you choose not to go to school, or if you get a test and it's positive, you're out for 10 days from the date that you had symptoms for the first time. And then that 10 days is an automatic 10 days. But then it could go longer, because you can't come back until you haven't had a fever for the 3 days, or symptoms for the 3 days. So in essence, it could be 13 days as the 10 automatic, and then you still had a fever on the 10th day. So 11, 12, so it went away on the 10th day. So 11, 12, 13, so 13 days you would be out. But again, that guidance may be changing. That's what I was told yesterday. So we just have to wait and see. Again, all this is so changeable. It may look very different by the time we get to September 2nd or 4th or 8th. Okay, any other questions on health and safety at all?
I don't see anything, so you might want to
No?
go on to facilities.
Yes, ma'am, I'll do that.
Okay.
All right, facilities. So one of the things, I mean, obviously the building is a big part of all of this. How are we going to keep it clean? What are we doing to, help the situation, if you will? So cleaning and disinfecting is a big thing. Obviously the CDC, for those of you in the know, and Department of Health have been instrumental in providing guidance for us on how we're going to clean, what we need to use to clean. Just so you know, we are using disinfectants that are EPA, that are registered by the EPA as disinfecting for COVID-19. The one we're using right now is called Vital Oxide, and that's what we'll start the year with at the very least. It is EPA registered. It's on that list. It's biodegradable, so it doesn't leave any kind of a film on at the surface of desks or tables or something after we use it. And we also, for those of you at the beginning, when I was talking to Mrs. Friedman about the clean desk policy, we do have a clean desk policy that we initiated. We expect all of our staff members to have clean desks at the end of the day. We're actually going to be asking them to help our custodial staff to clean and maybe clean the desks at the end of the day in their classroom, including their own, with some kind of a green cleaner to remove whatever's on there. Then the O&M staff can do their daily floor stuff. They can take care of the garbages, things like that, and then they can disinfect the surfaces in the classroom. So it's going to take teamwork to do all of this. It's a partnership. It's a partnership on health for your own health, your students' health, our health, and we really are all in this together. So it's a shared responsibility, shared health, and maybe we should make signs because that's really what this is all about. Ventilation. We are going to open up the dampers on our HVAC equipment. So basically, we're going to increase the amount of fresh air that's coming into the building as much as we can, weather permitting. Obviously, when we get into the colder months, that we're going to have to lower that down. The rooms may be a little colder this year because of that, but we'll do everything we can to get as much fresh air as possible into the buildings. We've also upgraded all of our filters wherever possible. Most of our equipment we can upgrade to, there's like a MERV 9A filter that has been suggested for us as the top of the line for our type of equipment, and that's what we've installed. So we're excited about that. And signage is the other part of it, and I think I've already spoken about that. It's really going to be everywhere, just to remind people of the healthy behaviors and different things they need to do to keep us all safe. I'm reading here. Access to buildings. We really are restricting the amount of visitors and the people that come into our buildings. So if you're a parent and you're coming in to drop something off, it's very possible you will not enter the building. You can come to the door, let people know, call the office, let people know you have something, and we will meet you at the door, or you can leave it outside the door and we can pick it up. That's the kind of stuff that we are going to do just to limit the amount of people that enter our facilities. If you do, or you're going to pick up a child, it would be probably the same way. You call the office, they bring a child forward, we will meet you at the door. We had a question last night, how long will that last? And how long that will last is until we don't need to do it anymore, really. It's just that for this foreseeable future, that's how we're going to do it, but hopefully not forever, right? Questions? That was it. That was the question. Any other questions on that at all? On either the health and safety or the facilities?
I did not see anything, so I think we're ready to move on to child nutrition.
Okay,
Excellent.
thank you.
Thank you, Mr. Sisson, for that update. And I'll be talking about child nutrition in our special education division as well as our CV Tech division. I would like to thank both directors working closely with Julie Holbrook, our director of child nutrition, working for our Mineville campus, our satellite campus, as well as our Plattsburgh main campus. So it really takes a village, and this summer is no different. Building principals working closely with Julie as well as we plan for what Jeff says, a new normal to start the school year. So let's start with CV Tech, as this has been most of the questions that we've received on child nutrition. Our CV Tech program, as Director Friedman said, is converting from a half-day program to a full-day program. With that change, CVES is preparing to serve meals to our CV Tech students on a daily basis. We will be serving breakfast and lunch to our CV Tech students, as well as serving breakfast and lunch to our special education division students on the same days. It will be at all campuses, Plattsburgh campuses, Mineville campus, and our satellite campus. We are members of the community eligibility provision at this time. We are applying for that same provision and expecting to be approved for the provision. What that means is students in the special education division, as well as CV Tech division, will be eligible for free meals, breakfast and lunch from CVES. So we do pride ourselves in serving high quality, nutritious meals to students. We are very happy and pleased that we'll be sharing those high quality meals with our CV Tech students this year. And we look forward to bringing our Farm to School initiative to the CV Tech students that our special education division students have enjoyed over the past year. Also, working in each division, we are specializing the meal service. So we will take different shapes depending on first being what school building you are in, and then what division you are in. And each one is being specialized based on spacing requirements, the safest nutritional space to eat food, as well as keeping social distance while eating. Students will not be required to wear masks while they are seated and eating food. Therefore, we are going to ensure social distance at meal times and meal service. We will use 4 different models. We're looking at a classroom service model where food would be served to the classroom. We're also planning for a cafeteria service model with classroom dining. So the students would go to the cafeteria, pick up their meal, and then eat it in the classroom. We will be using our cafeteria sparingly. There is space in the cafeteria for some students to eat their breakfast and lunch, and that will be used on a sparing basis, not similar to what you've seen before. Limited number of students will be in that space. We also will be looking at take-home meals. And then for remote food service, similar to what happened in the spring, we will be coordinating with our component school districts to assist us in meal delivery to students and what is most efficient and effective to provide those meals if we do end up going to remote learning only. So questions that have come in, we were looking at will there be charges for meals? Given the fact that we are the community eligibility provision, all meals will be free to students. There were questions about what would lunch be like and will meals be served daily. So meals will look different than previously as far as the type of service and the type of facility that they're being ate in or location in our building that students are eating them in. Our goal and our plan is to still serve high quality meals. Again, farm to table initiative is extremely important to us, and we do not want to revert back or do similar to what other entities may do, which is serve processed food. So we still plan to prepare high quality meals like we have in previous years and just serve more students at this time. I believe that answers the questions on child nutrition that had come in, my update, as well as the questions that I see listed. Any questions in the chat, Ms. Gray?
I did not see any. No, we're still at 0.
Okay.
So, well, no, I don't have any questions on that. So that was very thorough, very complete. Thank you. And there were a couple other sections in our plan that are still like some of the things we need to have more, it depends on the district. For example, transportation, as you know, our districts, our component school districts provide the transportation. Very few things are on campus going to require transportation. A few of our programming may. Special ed, I think, is going to limit our internal like transportation from our site to other sites. But there still will be transportation through the school districts, and those will vary. And I know they're talking about different drop-off and pickup locations, but I believe the 2 directors, but you'll be sharing that information with the families and letting them know what that will entail and where they'll drop off and where they can pick up. Correct? I see shaking heads, so I would say yes. And there is a section on equity with access to technology and to devices, both in accessibility. But I know that it was very well covered by our 2 directors as well. So that is an important piece, though, if there is a student who is in need of hardware or they don't have connectivity at home and we happen to be in a remote model, then we would definitely do everything within our power to make sure that they had access to the internet so that they could participate. So that's one of our other goals that we are making sure happens this time. We were surprised in March when all this happened, and now we are much better prepared thanks to the generous donation of the United Way. So I believe if there's, I don't know, did I miss anything else? Anyone? Okay, so I believe we're ready. I'm going to turn it back over to Dr. Davy to close this.
Thank you, Terry, and thank you to all the members of our CVES team. We are so pleased this evening that everyone joined us, and on behalf of our administrative team, all our staff, our BOCES board, we want to thank everyone for joining us this evening. It is our privilege to serve all our students, both in CV Tech and in the Special Education Division, and to work in partnership with our component districts. Their students are our students, and our students are your students. We hope these public forums have helped answer any questions you may have. As our parents and guardians, you are our key partners who we want to continue to work closely with and to be strategic partners as we move forward in the coming year. We understand that these have been trying times for everyone, and that as parents and guardians, you want to know that your students' health and safety is our #1 priority. It is. CVES BOCES is committed to continue to work closely with each of you. We've been strong partners in education in the North Country for over 70 years. We will come through this and we will do it together. We are committed to continuing to keeping our strong partnership and relationships more effective and stronger than ever. We thank you this evening for joining us, and we look forward to working with you and communicating with you as we move forward and serve your students in the coming year. Please reach out to Mrs. Friedman and her administrative staff if you have questions about CV Tech. Please reach out to Mr. Slattery and his administrative staff and team if you have questions about special education. And feel free to reach out to any of our team members, Ms. Calabrese Gray, our Assistant Superintendent of Instruction, 21st Century Learning, Mr. Eric Bell, our Assistant Superintendent of Management Services, and Mr. Jeffrey Sisson, our Health Risk Safety Specialist, who's helping coordinate all of our safety plans throughout our entire region. We're here to work with our community partners. We're here to work with our schools, and that's the mission and purpose of CVES BOCES. We've been committed to that for over 70 years, and we look forward to moving together into the future and making it through these crises. Thank you and have a great evening.